House will come back to order. House will come back to order. The clerk will ring the bell. What purpose does Chairman England rise?
Make a motion, Mr. Speaker.
State your motion.
I move for immediate transmittal of House Bill 31 back to the Senate.
That would be the appropriations bill.
That would be correct.
Chairman England has moved that House Bill 31 be immediately transmitted to the other chamber. Is there objection? Is there objection? The chair hears none, and it is so ordered. The clerk will read the caption to a group of privileged resolutions.
Commending and recognizing Shelley Winter, honoring the life and memory of Dr. Bill Jenkins, commending and congratulating Sidney Edgar, commending the McEachern High School boys basketball team for winning the 2019 GHSA 7A State Basketball Championship, congratulating Julie Ellison on the occasion of her 100th birthday and celebrating the 145th anniversary of the Trinity Church. Recognizing and commending the 2019 legislative session temporary administrative assistants for the House of Representatives on their exemplary service. Recognizing and commending Pastor Claude Ray James on the occasion of his retirement. Congratulating and commending Reverend Yvonne S. Wallace for receiving the 2019 Yellow Rose Nikki T. Randall Service Leader Award. Recognizing and commending the contributions of the Georgia Association of Latino elected officials in the state of Georgia for the past 15 years. Honoring the life and memory of Mother Mary Eliza Walker Ward. Honoring the life and memory of Dr. Susan Renee Krim McClendon. Honoring the life and memory of Patricia Johnson Bayard. Congratulating and commending Deborah Small Powell for receiving the 2019 Yellow Rose Nikki T. Randall Service Leader Award. Recognizing Garden City, Georgia as an international city and commending the tremendous economic impact the city's had on the state of Georgia. Recognizing and commending Nadia Theodore, Consul General of Canada in Atlanta, United States. Recognizing Improve USA. Recognizing and commending Police Chief James Conroy's outstanding public service, and for other purposes. That completes the reading of the privileged resolutions.
Is there any objection to adopting the privileged resolutions? The chair hears none, and the resolutions are adopted. What purpose does Representative Kelly rise?
To make a motion.
State your motion.
Mr. Speaker, I'd ask that House Bill 659 be moved from the Judiciary Committee to the Retirement Committee. Both chairmen are in agreement.
Clerk will read the caption.
House Bill 659 by Representative Kelly, the 16th, to be entitled an act to amend Part 6 of Article 8 of Chapter 2, Title 47, the Official Code of Georgia annotated relating to judges of the Supreme Court and judges of the Court of Appeals.
On the motion of Representative Kelly that House Bill 659 be withdrawn from the Judiciary Committee and transferred to the Retirement Committee, is there objection? Is there objection? The chair hears none, and it is so ordered. What purpose does Representative Cannon rise?
Thank you, Mr. Speaker. To make a motion.
State your motion.
I move that House Bill 577 be moved from the Industry and Labor Committee to the Health and Human Services Committee. Both chairs are in agreement.
Clerk will read the caption.
House Bill 577 by Representative Cannon and others to be entitled an act to amend Title 34 of the Fiscal Code of Georgia annotated relating to labor and industrial relations so as to enact the Working for Two Act.
On the lady's motion that House Bill 577 be withdrawn from the Industry and Labor Committee and transferred to the Health and Human Services Committee, is there objection? Is there objection? The chair hears none, and it is so ordered. What purpose does Representative Saines rise?
To make a motion that the rules be temporarily suspended so that 3 local bills may be read for the first time and assigned to committee.
Representative Saines has moved that the rules of this House be temporarily suspended to allow 3 bills to be read for the first time and referred to committee. Clerk will read the captions.
Unnumbered House Bill by Representative Saines, the 180th, to be titled an act to create the Camden County Spaceport Authority. Unnumbered House Bill by Representative Saines, the 180th, to be entitled an act to amend an act creating Camden County Public Service Authority. Unnumbered House Bill by Representative Saines, the 180th, to be entitled an act to repeal an act creating and establishing the St. Mary's Airport Authority.
On the representative's motion that the rules of this House be temporarily suspended to allow 3 bills to be read for the first time and assigned to committee, is there objection? Is there objection? Chair hears none, and it is so ordered. Each of the 3 bills are assigned to the Intergovernmental Coordination Committee. What purpose does Representative Vernon Jones rise?
Yes, Mr. Speaker, I'd like to make a motion that,
State your motion.
Mr. Speaker, there are 3 bills, local bills, that I have be read for the first time.
Clerk will read the caption of all 3.
Unnumbered House Bill by Representative Jones, the 91st, to be entitled an act to amend an act to incorporate the city of Stonecrest in DeKalb County. Unnumbered House Bill by Representative Jones, the 91st, to be entitled an act to amend Code Section 48.5, 48.4 of the Fiscal Code of Georgia annotated relating to homestead exemptions for unremarried surviving spouse of a peace officer, and unnumbered House Bill by Representative Jones, the 91st, to be titled an act to provide for charter review commissions for all municipal corporations located wholly or partially in DeKalb County.
On the gentleman's motion that the rules of this House be temporarily suspended to allow 3 bills to be read for the first time and assigned to committee, is there objection? Is there objection? Chair hears none, and it is so ordered, and each of the 3 bills will be assigned to the Intergovernmental Coordination Committee. What purpose does Representative Howard rise?
To make a motion.
State your motion.
I'd like to make a motion that the House suspend the rules for a bill to be read for the first time.
Clerk will read the caption.
Unnumbered House Bill by Representative Howard, the 124th, being entitled an act to amend an act establishing the compensation of certain officials in Richmond County.
On the motion of Representative Howard that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? Chair hears none, and it is so ordered. Intergovernmental Coordination. What purpose does Representative Gamble rise?
Mr. Speaker, I make a motion that
State your motion.
I move that the rules be temporarily suspended to allow a bill to be read for the first time.
Clerk will read the caption.
Unnumbered House Bill by Representatives Gamble of the 15th, being titled an act to provide a homestead exemption from City of Cartersville Independent School District ad valorem taxes.
On the gentleman's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee. Is there objection? Is there objection? The chair hears none, and it is so ordered. What purpose does intergovernmental coordination? What purpose does Representative Bentley rise?
To make a motion, Mr. Speaker.
State your motion.
I make a motion that the rules of this House be temporarily suspended so a bill can be read for the first time and assigned to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Bentley, the 139th, to be entitled an act to amend an act providing a new charter for the city of Fort Valley.
On the lady's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. What purpose does Representative Mitchell rise? I have to come back to him. What purpose does Chairman Dickey rise?
Make a motion, Mr. Speaker.
State your motion.
A motion for the rules of this House to be temporarily suspended so a bill can be read for the first time and assigned to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Dickey, the 140th, to be titled an act to amend an act, extend the limits of the city of Fort Valley and for other purposes.
On the gentleman's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. Intergovernmental coordination. What purpose does Representative Wilson rise?
To make a motion.
State your motion.
Mr. Speaker, I move that the rules of the House be suspended so a local bill may be read for the first time and assigned to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Wilson of the 80th and others, to be entitled an act to amend an act to incorporate the city of Brookhaven into DeKalb County.
On the gentleman's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. Intergovernmental coordination. What purpose does Representative Rich rise?
To make a motion.
State your motion.
I move that the rules be temporarily suspended so that a bill may be read for the first time and assigned to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Rich of the 97th, be entitled an act to amend an act creating a new charter for the city of Sugar Hill, Georgia.
On the lady's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. Intergovernmental coordination. What purpose does Chairman Belton rise?
To make a motion.
State your motion.
I'd like the House rules to be temporarily suspended to allow the bill to be read for the first time and assigned to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Belton of the 112th and others, to be entitled an act to amend an act to incorporate and grant a new charter for the city of Covington.
On the gentleman's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. Intergovernmental coordination. What purpose does Representative Douglas rise?
Make a motion, Mr.
State
Speaker.
your motion.
I move that the House rules be temporarily suspended so that a bill can be read for the first time and signed to committee.
Clerk will read the caption.
Unnumbered House Bill by Representative Douglas the 78th and others, to be entitled an act to amend an act create the Henry County Governmental Services Authority.
On the gentleman's motion that the rules of this House be temporarily suspended to allow a bill to be read for the first time and assigned to committee, is there objection? Is there objection? The chair hears none, and it is so ordered. Intergovernmental coordination. All right, we're going back to the rules calendar. We are going back to the rules calendar. Senate Bill 32 was previously deferred to the next legislative day, and it is being called at this time. The clerk will read the caption to Senate Bill 32.
Senate Bill 32 by Senator Kirkpatrick of the 32nd, Kirk of the 13th, Butler of the 55th, Payne of the 54th. Be titled an act to amend Chapter 1 of Title 51 of the Fiscal Code of Georgia, annotated, relating the general provisions relative to torts, so as to provide for conditions upon immunity from civil liability in instances of rendering emergency care. This bill having referred to the Committee on Judiciary. That committee recommends that this bill do pass by committee substitute.
Chair recognizes Representative Rich to present the bill.
Thank you, Mr. Speaker, ladies and gentlemen of the House. I bring to you today Senate Bill 32, which is a statute that will allow a person who, in good faith and reasonably believes that a canine in a locked car is in danger of dying, to call 911 or law enforcement and only then be able to rescue the dog without incurring civil liability for damage to the car and dog owner. And with that, I will yield the will unless there are questions.
Do you yield for questions?
I do.
Chair recognizes Chairman Knight to your right for a question.
This is Lady
Yes.
Ma'am, I don't see anywhere in the bill in cases where the person who would be breaking the window is held either responsible or liable for, in one scenario, if the dog were to jump out and get hit by a car, or in the second scenario where they were wrong in their assumption that the dog was in trouble and actually damaged the car, thus sending in a wave of events that would take insurance and court and all that. I don't see anything in here.
They are absolutely liable, civilly and criminally, if they did not act in good faith and reasonably, and it would be up to a judge in our state or superior court to hear the facts and sworn testimony and evidence entered into the trial in order to make that determination. But Georgia law, it does provide liability. This statute addresses immunity only, and it carves out a very narrow window for immunity.
One further question for Lady O'Yill.
Yes.
So again, in that situation where that person has broken into a car, broke a window, damaged the vehicle, possibly the dog jumped out of the window, and they made a mistake in their assumption. They were not reasonable. They did not understand the situation or the breed of the dog or whatever. Then the responsible pet owner who did nothing wrong is now subject to court, litigation, property damage, and is now faced with a cost of pursuing this?
No, you make an incorrect assumption. If the person acts in good faith and reasonable, as a reasonable person would, then there will be no liability. However, if that person does not act in good faith and does not act reasonable under the circumstances, which is a very common principle that we rely upon in Georgia law for many, many issues, then that person would be liable.
One final question of Lady O'Yill. So your description there is that a person acts responsibly and, you know, as a normal person would reasonably. Again, if they were wrong, even if they thought they were right, if they were wrong, damaged the car, put the pet in jeopardy of jumping out the window and getting run over, they are immune, and then the responsible pet owner, whose car was now broken into, is just out of luck.
That is
correct?
a separate question, not again, and that is correct. If they acted in good faith and reasonably, then you are correct. That person will have immunity.
Even though the pet owner did nothing wrong, the owner of that pet did nothing wrong, the dog was not indeed in jeopardy, and they're left with a vehicle that has now been damaged, and possibly the dog jumped out of the window and got run over, they're just out of luck.
Again, Representative, that is correct. Again.
Thank you.
Do you further yield?
I do.
Chair recognizes Chairman Watson to your right for a question.
Thank you, Mr. Speaker. Does the lady yield?
I do.
I just wanted to make sure this is only animals that are locked inside of a vehicle, correct?
That is correct. This immunity will apply only actually to dogs that are locked inside of a vehicle.
Okay, so how would it relate to dogs that may be in a dog box? So they're hunters, those
No,
excluded from this?
that would not apply. The dog has to be in a locked vehicle, motor vehicle.
Confined in the vehicle and locked.
That is correct.
All right, thank you very much.
And if there are no further questions, I'll yield the well.
You got a lot of questions.
I'll take
But it's
I'll take
up
a
to
couple,
you.
I'll take a couple more.
Chair recognizes Representative Stover to your left for a question.
Thank you, Mr. Speaker. Does the lady yield?
I do.
Can you define what a dog in distress or a hot dog may look like in a car?
I would not be able to make that determination. That would be a determination to be made by a state or a superior court judge who is hearing the sworn testimony and considering evidence entered into the trial, if there were one. I do.
Would you be surprised to know that there are cars now with a dog mode and the air conditioning continues to run when the owner has left the car, yet a dog, when locked in a car, may feel in distress and look like he's panting, even though the air conditioning's on? Do you feel it's okay for someone to pick up a brick and break into that car when the owner is acting responsibly?
Absolutely not. And the statute does not provide immunity in that circumstance. Because that would not be reasonable for someone to break into a car where there is climate control in the vehicle.
Do you further yield?
I do.
How is a person on the outside of that car to know that there's climate control in that vehicle if the car is not running? And in fact, a Tesla, the new Teslas that have come out, have a dog mode. The cars are silent as they are when they run, and all that runs is a fan inside the car, not allowing the person on outside of that car to know that there is a dog in there that is not in distress.
The statute would require the person seeking immunity to be able to establish that he or she reasonably believed that the dog was in danger of dying. So there would be some evidence, photographic evidence, witness statements that would be necessary.
Do you further yield?
I do.
So you believe it's okay for the person in that instance to break into the car even though the dog is not in distress, even though just because the person thought they were acting in good faith?
That does not follow because the statute requires that they act in good faith. So no, I would not say that someone be authorized to break into a car where there is not evidence to substantiate that the person reasonably believed that the dog was in danger of dying.
Yeah, I don't agree.
Do you further yield?
For one more.
Chair recognizes Representative Jasmine Clark to your left for a question.
Does the gentlelady yield?
I do.
Could you also expound upon what happens if a person reasonably believed that the dog was in distress and they break the window and the dog jumps out and bites someone, let's say in a parking lot, or and who would then be liable for the damage that occurs after that dog is out of the vehicle?
The liability would remain the same. As long as that person were acting reasonably, the liability would always be with the dog owner, not with the person who intervened.
Do you further yield?
Yes.
All right, so just for clarification, the dog owner would then be, even, so to go back to what he was saying, even if the person didn't realize that there was climate control, they break the window, the dog jumps out, not only might they be liable for fixing their own vehicle, but now they might be liable for damages to anyone who got hurt by that dog.
Well, your premise was even if they didn't know there was climate control. So I don't know the other facts in your hypothetical, but if there was evidence to believe that the dog was in danger of imminent dying, then that person would have been considered to have acted reasonably. And yes, the liability would remain with the dog owner who had locked its dog inside of a hot car.
All right, thank you.
I yield the well.
Lady has yielded the well. Chair recognizes Chairman Knight to speak to the bill. Just a minute, Mr. Chairman. All right, we're on the rules calendar and we are debating some important issues, and the members in the well are entitled to your respect and attention when they are speaking. Gentlemen may proceed.
I don't want to make light of the issue of people, irresponsible pet owners, people who don't care about animals. Someone who grew up with dogs and have dogs now that are a member of the family, and we hold them dear, spend too much money on them, taking care of them. My wife's sitting here trying to talk me into a lab right now. It is a serious issue. And to the gentle lady, I know that she's very passionate about this issue. But I want us to drop back and think about what we're placing, the liability, and what we're placing other people in, because some people thought they were acting in good faith and reasonable. They thought. Because if they were wrong, you heard it, then the pet owner is responsible. The pet owner, to the gentle lady who asked the question about the bite, now all of a sudden, that pet owner is responsible. The damage to the vehicle. Now all of a sudden you've drugged people in, innocent people in, to a legal situation in which they've got to go to court, hire attorneys, and you're giving immunity to somebody else who was at fault and made the wrong choice. Again, to the lady, I hate people who treat animals with disdain and with no respect. But I also know that there are people out there whose judgment is far over the hill about animals, and they think that animals are human. They actually care about animals more than they care about humans. And those are the people who are going to be breaking your windows and making irrational judgments. I'd ask that this body reconsider what it's about to do on this bill, because it's moving into a situation that quite frankly is going to put a lot of innocent, responsible pet owners in a bad way. Thank you, Mr. Speaker.
Gentleman has yielded the well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to adopting the committee substitute? The chair hears none. The committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill now pass? All those in favor of the passage of Senate Bill 32 will vote aye. Those opposed will vote no, and the clerk will unlock the machines. Have all members voted? Have all members voted? If so, the clerk will lock the machines on the passage of Senate Bill 32. The ayes are 46, the nays are 108. This bill, having failed to receive the requisite constitutional majority, is therefore passed. Clerk will read the caption to Senate Bill 106. We are still on the rules calendar. House will be in order. Clerk will read the caption to Senate Bill 106.
Senate Bill 106 by Senator Tillery, the 19th, Strickland of the 17th, Miller of the 49th, Dugan of the 30th, Kennedy the 18th, and others. Be entitled an act to amend Article 7 of Chapter 4, Title 49, and Title 33 of the Official Code of Georgia Annotated relating to medical assistance and insurance, respectively, so as to authorize the Department of Community Health to submit a Section 1115 waiver request to the United States Department of Health and Human Services Center for Medicare and Medicaid Services. This bill having been referred to the Committee on Quality Health Care. That committee recommends that this bill do pass by committee substitute.
Chair recognizes the governor's floor leader, Representative Lott, to present the bill.
Good afternoon, House. I am here today, and I am proud to be here today to say that the governor of this great state, Governor Kemp, is making health care of Georgians a priority, and SB 106 offers us the ability to make great improvements for the benefit of Georgia, our providers, our uninsured, and those struggling with the unbearable costs of premiums within the individual and small business marketplace. This simple two-page bill allows for the Department of Community Health to submit an 1115 waiver application and for the state of Georgia to submit a 1332 waiver request. The 1332 waiver waives provisions of the Affordable Care Act to create innovative ways to address costs within the individual and small group marketplace. We have seen states use 1332 waivers to create high-risk pools and reinsurance programs to lower insurance premiums in a substantial way for those in, again, the individual and small business marketplace. The 1115 waiver it allows the state to waive provisions of the Federal Social Security Act of 1965. SB 106 must come before the General Assembly so that we may consider Medicaid programs for non-disabled adults. Recently, we have seen states use waivers to enhance benefits for behavioral health and substance abuse, work requirements and community engagement provisions, co-pays, and health behavior incentives. There has been great talk about this legislation, so I'd like to address some of the concerns that have been stated, and I'd like to inform those in the room what it means to vote yes or no to this bill. By voting no to SB 106, Governor Kemp will still make health care a priority of his administration. If you vote no to SB 106, the Department of Community Health will still use funds appropriated in the amended budget to perform a top-to-bottom review of our Medicaid program, and that has not been fully looked at since its inception in 1965. If you vote no, the Department of Community Health will still be able to develop waivers and submit waivers to CMS that will help innovate and modernize our current Medicaid program. And if you vote no to SB 106, we will, using money already appropriated, be able to improve the program for our current population of poor children, pregnant mothers, elderly adults, and our state's disabled. But sadly, if you vote no and this bill fails to pass, the only thing that you have accomplished is we cannot, by law, submit a waiver that allows us to help those in the coverage gap. We cannot consider any options to improve the health of non-disabled adults below 100% of the federal poverty level. This will limit our ability to help many with substance abuse and opioid disorders, as well as many with behavioral health needs. Secondly, we will not be able to submit a 1332 waiver, which has been demonstrated to decrease the insurance premiums to those in the individual and small business marketplace. 1.3+ million Georgians are currently uninsured, and they will be ignored if you choose to defeat 106. The potential for new insurance options and improved competition within the exchange plans will be gone. Governor Kemp has made health care a priority and is putting Georgians first. Will we, here in this body, please join me in voting yes to SB 106? Mr. Speaker, I yield for questions.
You have a few. Do you yield?
I yield.
Chair recognizes the Minority Leader of the House, Leader Trammell, to your left for a question.
Will the lady yield?
I do, yes, sir.
With respect to the 1115 waiver that's referenced in Part 2, Section 2-1 of the bill, is it the intention of the administration in pursuing an 1115 waiver to cover every Georgian under 100% of the federal poverty level who presently does not have any type of available coverage?
It is the intent of this bill to give us great opportunities. We have had the opportunity to, our administrators within the Medicaid system have had opportunities to go to Washington and have real conversations with CMS and those that work there. It is our intent to give health care options for those people entirely in the groups of Georgia, not below 100, not above, but all. All Georgians need access to available, affordable health care in Georgia, and we are very fortunate. We're in a very good situation, which is why our waiver is designed the way that it is. We have been encouraged by those in Washington to come up with creative and innovative ways to develop those available options.
Will the lady further yield?
Yes, I will.
Is that a long way of saying that the answer to my question is no?
Well, maybe I should get you to clarify the question. Are you asking if Medicaid is the only option?
Will the lady further yield?
Yes, sir.
So the question is it the intention to provide coverage to everyone who is presently under 100% of the federal poverty level that lacks coverage and the ability to obtain coverage today?
It is the intention to provide health care in Georgia to our citizens. And the difference between a political question and a health care provider question is that this book was the Affordable Care Act. And the states that have taken this on and watched this will recognize and do recognize that one of the things that we did badly, very badly, when we designed this bill was that we focused on the insurance card and not the health care needs of the people. And in doing so, what happened was we made every effort to give everyone an insurance card, but what that led to was high premiums, high deductibles, and people seeking less care. So this bill has been written in a general manner with health care being the priority of this legislation. The care of the citizens of Georgia making certain that there are providers available and that it is affordable for everyone in Georgia to be able to obtain good quality, high quality health care. We've got the ability to do that in this state. This bill does not focus on whether or not you have an insurance card in your wallet, because that was the mistake of the Affordable Care Act agreed upon by nearly every state.
Do you further yield?
I yield, yes, sir.
Chair recognizes Representative Holland to your right for a question.
Thank you. Does the gentlewoman yield?
I do, thank you.
So is it not true that the Georgia Chamber of Commerce convened a task force to address Medicaid expansion in Georgia? And when they did, 2 of the 3 action plans recommended by the business community asked for coverage up to 138% of the poverty level, either by Medicaid expansion or private insurance funded by Medicaid.
So I can't speak to the specifics. I thank you for the question because I don't have that available information. I will say this, that there has been a lot of confusion and incredible misconceptions in where the coverage gap, those that do not have availability for the access to insurance coverage, where that gap is. And even as recently as the Senate hearing on this bill, there were quite a few people that actually spoke either by asking a question or even in the well, and made reference to the fact that they believed that those below 138% of the federal poverty line did not have the availability to obtain health insurance on the federal exchange plan. So for clarification, I am not certain as to the Georgia Chamber's position at that time. Of course, you do have a Georgia Chamber letter on your desk at this time that does state promoting innovation and efficiency in the healthcare system is a priority of the Georgia Chamber. We believe Senate Bill 106 will help improve those outcomes. Furthermore, we believe that SB 106 has the potential to reduce private health insurance premiums for all Georgians and reform the state's delivery of health care to those beneath the federal poverty line. So I just want to clearly state what we are doing is creating a means by which we can help those below 100% of the federal poverty line, and that those that are 100 and above have access to the federal exchange plans with subsidies.
Does the gentlewoman further yield?
I do, yes, ma'am.
So just so that I'm clear, by not covering that additional gap up to 138% of the poverty line, those that would fall into that gap are those making between $12,000 and $16,000 a year, for whom, even with a subsidy, paying that greater percentage of insurance actually would bring them below the poverty line if you subtracted that from their annual income. Is that right?
So no, absolutely. It is a gap. There is no, you described it by using this word gap, and this has been the greatest confusion and the most difficult part of the job that I have today, is that people have very little understanding of what not only this bill does, but really what the system is that has been written about in this book. This is a book that I had the opportunity to highlight years and years ago when it first came out. The federal exchange plans allow you to have access to health insurance with subsidies from 100% of the federal poverty line and above. Going above from 100 to 400%, you are on subsidies. Anything above that, you are included in the individual or small business marketplace. These subsidies, for a bronze plan, your premium would be $0 a month. If it were a silver plan and you were at 100% of the federal poverty line, your premium would be $21. There is a responsibility for you. That information is on the Kaiser. You can run the little model on the Kaiser Family Foundation. But this is what's been so difficult about this, is that the information provided to people has been so inaccurate for years that we've stopped encouraging people to use the exchange plans. I've had conversations with hospital groups and asked how it is you have a frequent flyer, someone who continually returns to your emergency room, and we have not somehow encouraged them to get the insurance that is available to them.
Thank you.
Thank you. I yield for further questions.
Chair recognizes Chairman Welch to your left for a question.
Thank you, Mr. Speaker. Does the lady yield?
I do, yes, sir.
As a question, is it not true that the that Obamacare, or the Affordable Care Act, was the result of the state of Massachusetts' experimentation with health care reform?
I believe that to be true.
And is it not further true that this legislation would allow, well, before I get to that one, is it not true that the Obamacare legislation is a one-size-fits-all approach to health care across the United States, and that this legislation that you're proposing on behalf of the governor's office is this legislation would actually revert back to and allow states to innovate as to, particularly the state of Georgia, to innovate as to what is important for its citizens across the state, and allow for the governor's office to pursue a waiver on that innovative health care system that would best fit the state of Georgia, as opposed to trying to fit a square peg into a round hole, which is what we've been asked to do year after year. But this is a solution that would help the state of Georgia, but be tailored specifically to the state of Georgia. Is that not true?
That is true, and I thank you for that question, and I would like to add to that. The waiver system is being used by states, even those states that had originally agreed to take the Affordable Care Act expansion version of expansion, being the 138% of the federal poverty line. Many of the states that had decided to do that are already they have already asked for a waiver to alter that plan, recognizing that it did not work the way that it seemed as though it would, or they are currently considering waivers. And that is something that we have made a conscious effort to do correctly. We want to use these waivers. I appreciate your question. The waivers do offer the opportunity for Georgia to do this the way that we need. We need to address our opioid crisis. We need to address our uninsured. It is important to remember that there are not 240,000 uninsured in Georgia that we are talking about. One of the huge misconceptions of this bill as well has been that people will tell me that we are talking about the uninsured below 138% of the federal poverty line, which is estimated to be 480,000 Georgians. And the truth is there are 1.3 million Georgians plus in our state that need access to affordable quality health care. And if we choose to vote no today and just ignore the rest of those people, I believe that we are doing a disservice to our state, to our health care providers, those that are currently not able to get reimbursed for their services. Mr. Speaker, I yield for more questions if there are any.
Chair recognizes Representative Holly to your right for a question.
Thank you, Mr. Speaker. Does the gentlelady yield?
I do, yes, sir.
Is it not true that Arkansas, Massachusetts, just like my colleague mentioned, and Utah previously submitted waiver requests for the same eligibility requirements as specified in SB 106, but still were denied?
That's a great question, and I thank you for that. Massachusetts and Arkansas took the agreement years ago to expand Medicaid, 138% of the poverty line and below, and put those people into their Medicaid system and take free money from the federal government. And as soon as they had a responsibility to pay their fair share, they said, oh no, this does not work. We cannot afford this. And they requested to go to 100% of the federal poverty line, which is what we in Georgia are doing here today. They were denied, accurate in your statement, they were denied because they accepted money year after year after year, taxpayer dollars, and then they changed their mind. Then they wanted to do it the way we have stated is the right way to do it. Utah is an exception. Utah is closer to us. They never accepted the Medicaid program as put out and put forth in the Affordable Care Act. They waited, and in October of 2018, new rules were promulgated by CMS that said, we are open-minded. Bring us, for those states that did not take Medicaid expansion and use the federal tax dollars all these years, we are open-minded, give us your requests. And since then, Utah has submitted to go to 100% of the federal poverty line. It has not yet been, it is pending. It is pending at this moment, so not yet been decided.
Does the gentleman lead further?
I do.
Is it not true that Since the time of the initiation of the Affordable Care Act up until now, that this House has yet to pass any form of meaningful legislation to expand Medicaid?
So that's kind of a tricky question for me. I'll answer as best I can, and you tell me if I didn't answer what you wanted to know. Medicaid has grown by 18% since 2013 at the onset of the Affordable Care Act. Is that the answer? We have not required legislation to do so. It is within the body of what the original objections, the original core of what our Medicaid program is for.
No, I can clarify. Further you?
Yes, yes.
Has the House, has this chamber been able to either modify or provide legislation to cover the over 500,000 Georgians without Medicaid, just like my sister, Sortika Holly, who died last year and forced me to go and run for office to expand this Medicaid?
I'm very sorry to hear about your sister. And
I'm very sorry for the other 500,000 Georgians who will not get a Medicaid deal that's worthy of wait. Thank you.
Thank you. I would like to respond. There are an estimated 240,000 Georgians that fall below 100% of the federal poverty line. And in your estimate, the additional 240 or so are above 100% of the federal poverty line. They do have access to insurance on the federal exchange with significant subsidies. And we are blessed to be here today to be able to do exactly what you're asking, and I look forward to your vote on this bill.
Do you continue to yield?
I'll take one more, sir. I know there are others to speak.
Chair recognizes Chairman Knight to your right for a question.
General Lady Lee.
I do, thank you.
General Lady, isn't it true that what we seek to do with these waivers is design a plan that fits Georgians?
Yes, sir, that is correct.
Isn't it further true that Georgia has led in a lot of ways as far as trying to get a handle around the excessive cost of health care, particularly within health insurance and PBMs?
Yes, sir, I believe you are correct in that, and I believe you have legislation currently to move forward to help us with the cost of health care in Georgia.
So, question to the lady, isn't it true or wouldn't it be prudent that this body seek to get a waiver in which we can design health care for those who most need it, but do it in a way in which we can make sure it's affordable, and that furthermore, we're not just throwing more money into a Medicaid system that, quite frankly, is very expensive, and a lot more of that money is going into health insurance and to the folks who are administering Medicaid, and we can design something where we're putting the money back to the people who really need it.
I appreciate your question as well, and I would like to say further, this legislation, because of the money that we appropriated as a body, we have the ability now today to reevaluate, reassess, and get our hands dirty looking at the Medicaid system that started in 1965 and has not been significantly looked at. We have the potential to discover that there may be money on the table, fraud, waste, and abuse, that we know for a fact that there are some archaic practices that we have not stepped up to do properly. We know that there are things like transportation that are issues in healthcare and in our Medicaid system, that we have new systems, new things in place, such as Uber. Why are we not using some of the technology that is available today and some of the great innovative ideas that we have in this state? So just to add to that, I do appreciate that we have this opportunity right here, right now, to look at our program. And again, as I said before, if you vote no to this legislation, we will still reevaluate Medicaid, and we will do what the state of Georgia can do, everything that we can do to modernize this program for those that are currently within it. But if you vote no to this legislation and it should fail, all that you are doing is stopping those within the coverage gap, those that have remained uninsured, from getting any assistance. You have stopped us from rethinking and creating new programs for our substance abuse, opioid addicted, and behavioral health folks, and we don't want to be in that situation. So I thank you for your time, and Mr. Speaker, I know there are others, and I'll yield the well.
The lady has yielded the well. Rules Committee Chairman tells me that the Rules Committee has limited debate on this measure to 1 hour, with that time to be allocated by the chair. Chair is going to allocate 30 minutes to each side in total, and I will let the speakers then allocate amongst themselves. 30 minutes per side. We will begin with the opponents of Senate Bill 106, and the chair recognizes Representative Schofield to speak to the bill.
Thank you, Mr. Speaker, and to my colleagues in the House. I rise in opposition to SB 106. Truthfully, is this the best that we can do to address health inequities? Come on, I think not. We've deliberated, we've debated, and we're determined to do something. But I don't believe that we all know this bill won't do enough, covering fewer than half the people who could benefit. And we say we're not ignoring them. We've proven that there are more efficient cost benefits to full Medicaid expansion. We've talked about health care as a human right, but sadly, since some of my Republican Senate and House colleagues have little regard for the population that fully expanding Medicaid protects, let me state the majority of Georgians who stand to lose are working in low minimum wage jobs where they're not offered health benefits. And let me be clear, who can't afford health insurance, more importantly, the premiums and copays. And we also know that this bill puts an unrealistic work environment in place. We know this bill excludes those living below the federal poverty line, and to them we're saying, oh well, take what we can get, at least we're offering you something. SB 106 does not cover the gamut of Georgians, nor does it show Georgia's generosity toward protecting our young, particularly college students, veterans, working parents, people with mental illness, physical or invisible chronic illnesses. We in this chamber know that the majority of people that are left out are working. They're just trying to feed their family and need access to the right health insurance. This is as much as a rural issue as an urban one. Listen, we can all agree that farming is a fundamental profession here in Georgia. In fact, agriculture is one of the most dangerous industries in the country, according to the CDC. Did you know every day about 100 agricultural workers suffer from injuries that force them to miss work? Farmers are nearly twice as likely to die on the job as police officers and 5 times as likely as firefighters. Many farmers have farm insurance policies that covers a tornado, takedown in a greenhouse, and liability if someone gets sick from their produce, but it's shameful that they as human beings don't have anything to protect them if they're sick. So what if farmers who don't earn enough money to qualify for financial help, how are they supposed to get insurance in the marketplace? We're sending a great message, Georgia. Don't worry, I'm not going to address the most vulnerable population in rural Georgia that are without health care, hospitals, and medical providers. So here I stand once again to tell you how disgusted and disappointed I am that we're offering up a bill that works for some but not the many. Let's wave goodbye to these waivers and stop sacrificing healthy and unhealthy people who the state feels have to beg for health insurance. Give us some dignity. My dear colleagues, people don't want to be sick and worry about health care. So I'm saying that the people that put you here, this may not be your life experience, but the people that need full Medicaid expansion, this is their daily struggle. To those supporting this bill, may want us to take the crumbs offered, but I stand to tell you sick people need the whole loaf. We need this legislative body to do the right thing instead of pretending to make the wrong thing right. Mr. Speaker, I yield the well.
Chair recognizes Representative Robichaud to speak to the bill.
Thank you, Mr. Speaker. I come to the well today to express my opposition to SB 106. Medicaid 1115 waivers are to be used to develop experimental, pilot, or demonstration projects which can improve the core healthcare purpose of Medicaid, improving and providing healthcare for the vulnerable members of our society. Some examples that have been tested in the past have been very successful, and others have been failures in this core mission. My 35-year career has been in healthcare quality improvement, and I have been involved in many different types of projects across the 6 southern states and Georgia. My specialty is in creating viable, effective systems of care which reduce health disparities and assure access to quality health care for everyone. The major guiding principle has always been the right care for every person, every time. I've worked with FQHCs and other primary care physicians, nurses, emergency room physicians, cardiologists, neurologists, and other physicians, EMS providers. I've worked with healthcare administrators in both inpatient and outpatient settings. I've worked with healthcare insurance providers and payers to ensure efficient management of limited resources. Those of us in this field know that projects can only take us so far. At some point, a successful project must be expanded to cover all of those in need. There are already many successful models that will reduce hypertension in African American populations, models that will provide high quality care for people with diabetes, and also models that will provide excellent and safe prenatal care to allow for an uncomplicated pregnancy and healthy child. My life's work has been in developing, testing, and then implementing these vital life-saving models. A Medicaid waiver, 1115, will not save those lives that are currently in desperate need of assistance. The legislation proposed removes this legislative body from any determination of the types of waivers to be brought forth or the deliberative determination of success or failure of the chosen experimental projects. How will success be measured? What are the criteria for further expansion and implementation of any of these projects? In my career, we never started a project without clear and concise parameters of what is to be accomplished, how success or failure will be measured, and how the project will be sustainable into the future. I do not see any such parameters in this bill. This bill removes any oversight from this deliberative body. This bill will allow winners and losers to be chosen instead of making all Georgians winners by providing them with life-saving, life-altering quality health care now. The citizens of Georgia cannot wait for an experimental, pilot, or demonstration project. Their lives are on the line, and I yield the well.
Chair recognizes Representative Lopez Romero to speak to the bill.
Thank you, Mr. Speaker. Good afternoon, colleagues. I rise today in opposition to SB 106. I want to start off by reminding us at a more globalized level that human rights are universal and inalienable, as are our constitutional rights. In fact, the World Health Organization's constitution stated that the highest obtainable standard of health is a fundamental right of every human being, and that fundamental right creates a legal obligation to support the right to health, including the allocation of maximum available resources, not the least common denominator that waivers intend to do. The right to health also requires policies and programs that must prioritize those with the furthest need or those that are furthest behind in order to increase greater equity. The right to health includes 4 major components: availability of sufficient quality of facilities, goods, and services; accessibility that requires analysis of barriers such as financial and affordable issues; acceptability of medical, ethical, and culturally appropriate sensitivity to gender, including the right to choice of medical decisions; quality, and lastly, the quality of facilities, goods, and services that must be scientifically and medically approved. But as I mentioned, that is our global perspective on the right to health. Now let's consider the actions that we have done here in the United States through the Affordable Health Care Act, which represents, as has been mentioned, the largest change that we have had in our healthcare system. But most notably, amongst the many other changes that did provide gender parity in cost of premiums and also protecting those with pre-existing conditions. The number of uninsured Americans who have gained health care coverage under the ACA, particularly under the expansion of Medicaid through the ACA, have been somewhere between 9.3 to 16.4 million people. That's a sizable reduction from the pre-ACA uninsured population of 57 million Americans throughout our state. Now, the ACA has permitted further access to health care through full Medicaid expansion, which we had the opportunity to provide our Georgians, our constituents, this legislative year. Instead, we have neglected the opportunity by not expanding full Medicaid. Instead, we are seeking authority to give less meaningful and full access to our constituents to health care, particularly as we consider the 4 components of that right to health. In fact, as has been mentioned, a key feature of every 1115 waiver that has been approved, even in the most conservative examples such as Arkansas, Indiana, and Kentucky, has been to the eligibility of 138% of the federal poverty guidelines. And those waivers were approved with 90% of the costs being covered, while also permitting the waiver of different rules and regulations to achieve certain targeted goals. The reality is that with SB 106, we are, by capping the income threshold at 100% of the federal poverty level, it is virtually having us as a state pay for more whilst actually covering less people and providing less benefits. The only way, as had been previously mentioned by the author, that we can have businesses have a lower cost is by actually providing less benefits when Medicaid already covers only the very fundamental of preventive and healthcare needs. The state also risks only getting 76% of the costs covered by the federal government instead of the 90%. Another fact that has been mentioned already, Wisconsin not added to Arkansas, Massachusetts, and Utah, with Wisconsin and Utah requesting it for the first time, reducing something that mirrors SB 106, which reduces the threshold to 100% of the federal poverty line, have been rejected with the 90% federal funding. But let's just say, as has been alluded to here, that the federal guidelines in fact make a change and depart from the waivers that have been approved and do allow this unprecedented deal that Georgia is seeking to have. The only thing that we will be doing in that instance is creating a different gap, the new gap that would otherwise not exist in other Medicaid waiver states, and that is the gap for Georgians between 100 to 138% of the poverty line, which is for individuals somewhere of earning between $12,000 to $17,000 a year. And then on top of that, they would still have to pay more out of pocket on the marketplace compared to what they would otherwise pay if enrolled in full Medicaid expansion. That gap is still an estimated 226,000 Georgians that we will still have in a gap by choosing to go through a waiver route. We should not continue to make the cost of health care a barrier for our constituents to access to health care. In fact, the most recent data available shows that Georgians between the ages of 19 and 74 of that age bracket, 19% are uninsured, and we have the 4th highest rate in the nation. It's already been said, but it is important to emphasize. Rural communities also face serious financial challenges compounded by the disproportionately high level of uninsured residents in the state's poorest areas. And since 2010, we've had 7 hospitals shut down their doors, while others are struggling to maintain the high levels on uncompensated care. And that gap that we would create with this waiver of 224,000 Georgians are Georgians that are actually most populous in these rural areas. The opportunity to lay the groundwork for transformative healthcare reforms that significantly increases access, improves health outcome, and draws down billions of dollars in additional funding can be and should be done through full Medicaid expansion. That's why I urge you today to vote no on SB 106. Otherwise, you are voting and asking for taxpayers to pay for more for less medical coverage and benefits. Mr. Speaker, due to time constraints, I'm going to yield the will.
Chair recognizes Representative Mary Frances Williams to speak to the bill.
Thank you, Mr. Speaker. I come to the well today to speak in opposition to Senate Bill 106. And there are two aspects of this bill that I want to talk about. First of all, if Medicaid is expanded only to 100% of the federal poverty level, what happens to people with incomes between 100 and 138% of the federal poverty level? What will the health insurance options be, and how much will they cost? How many Georgians fall into this category? My second point is Senate Bill 106 talks about two different kinds of Medicaid waivers. I am particularly concerned about the 1332 waivers. What is a 1332 waiver? Under new guidance from the Trump administration, what can a state do with a 1332 waiver? Who makes decisions about what Georgia might do if granted this waiver? Is there legislative oversight? But first, I want to say that as I've thought about health care legislation under consideration this year, two former state representatives have been in my thoughts. The first is former Representative Henry Bostic of Tifton, who served for 26 years during the period of 1958 to 1996. I did not know him all that well, but the thing I remember about Representative Bostic is that often during floor debate on a bill, he would stand up and say, "I'm thinking about the hard-working bandy-legged waitresses at the diner down the street. How will this affect them?" That was not the sort of question I remember hearing very often, and I came to think of him as a voice for working-class Georgians. And I loved it that he would pop up and ask that question. Senate Bill 106 proposes expanding Medicaid to 100% of the federal poverty level. Originally, the ACA wanted states, of course, to expand to 138%. I know others that will talk today about the federal match rate available and the hope that CMS, the Federal Centers for Medicare and Medicaid, will decide to offer the full 90% federal funding match to states that do partial expansions as proposed in this bill. I want to talk about people with incomes from 100 to 130% of the federal poverty level. We still have about 230,000 people between 100% and 138% that are uninsured. We're talking about incomes, as has been said, from $12,500 about to a little over $17,000 for an individual at 100 and 138% of federal poverty level. And for a family of three, we're talking about incomes of slightly over $21,000 to just under $30,000 for a family of three. I hope we would all agree that that is not a lot of money to live on. And I think some of the waitresses that Representative Bostic used to talk about would be covered, would be falling in this gap. In order to purchase health insurance, these Georgians will be dependent upon the marketplace exchange. On the exchange, these people must pay up to 2% of their income for health insurance premiums. They will also have deductibles and copays. The problem is those costs will still take a huge bite out of monthly income. 2% of $12,490 is about $250 a month. And that's a lot of money at such low incomes. Even the subsidized health insurance rates on the marketplace are financially out of place for many people. It is estimated that for low-income families, healthcare costs eat up 18 to 20% of income for them. Now I'm going to talk a little bit about the 1332 waivers. They are covered in Part 3 of SB 106. This bill authorizes the governor to submit 1332 waivers. They're called state innovation waivers. But the Trump administration substantially changed the rules for those kinds of waivers. The governor and the Department of Insurance will have wide latitude to make significant changes to Georgia's private health insurance market without any input or oversight from the legislature. I'll say that again, without input or oversight from the legislature. Examples of the kind of things that might happen or could be done under this waiver would be the governor could waive essential health benefits. There are 10 now in the ACA. Some of them are coverage for prescription drugs, mental health substance abuse treatment, maternity coverage, well child visits, and immunizations. So we could lose those essential health benefits. Also, the governor could restructure the financial assistance currently in place for low-income Georgians. Georgia could decide to take the federal subsidy as a lump sum and spend it in different ways. The governor could remove financial assistance to lower income individuals and spread that money across all insured. Also, the availability of non-ACA compliant plans would be a problem. It would undercut protections against discrimination based on age or health status. These kinds of programs effectively pull healthy people out of the marketplace, leaving mostly sick people, and this would cause premiums and deductibles to rise. Now I want to talk about former Representative Mickey Chanel and Peach Care. When Peach Care was first being talked about, then Governor Zell Miller had a very different plan for how to implement the new federal children's health insurance program in Georgia. Representative Chanel worked very hard to develop what was named Peach Care for Kids. He led a small team, including a representative from across the aisle and 2 public policy advocates. Peach Care for Kids was and is considered the model for how states should implement CHIP, and Mickey Chanel traveled all over the country talking to other states about how it had been done in Georgia. He and the House of Representatives bucked the governor to come up with the best plan for Georgia's children. I'm going to say that again. Representative Mickey Chanel and the House of Representatives bucked the governor to come up with the best plan for Georgia's children. I keep thinking about Representative Chanel. I know we're better than this piece of legislation. Let's do what Mickey Chanel and the Georgia House did 20 years ago when we had the choice to make about Peach Care, and we did the right thing. I yield the well.
Chair recognizes Representative Dreyer to speak to the bill, and you have 8.5 minutes, Representative.
Thank you, Mr. Speaker. I get the privilege of coaching youth basketball during the week and on the weekend, and my oldest son just jumped up to a higher league, and I had to coach their team in a more competitive league. And what I saw was a lot of kids that were throwing the ball and they froze. They held the ball, they looked around, they didn't know what to do. Instead, I'm encouraging these kids to not be timid and to not be reckless, but to be confidently composed. And I don't believe this bill is confidently composed, and I don't believe it's the right solution for Georgia. We've previously heard about the flaws with this bill. I've told a lot of them to you myself. This plan would cover 200,000 less people than fully bridging the Medicaid gap, and we will likely be paying more. If we fully bridge the Medicaid gap, we are guaranteed a 90% federal money on what we spend, and we know we can afford it because we have the fiscal note. When we used to think that 90% federal match would give us about $1 billion, maybe a little more, in federal health care spending, but because of the fiscal note that was developed here in the General Assembly, we know that's going to be over $2 billion in federal health care fund coming here. With waivers, we get less than half as much care, and we will be paying more. The last time I spoke, I heard a few objections, and I did some research, and I appreciate that. Specifically, we're talking about Georgians in 100 to 138% of the federal poverty level. And those folks, it's true, do get subsidies. They can purchase health insurance at a discounted rate. But what they can't get the help they need with is the cost sharing. because there is so little money available to the people between 100 and 138% of the federal poverty level under the current plan we have now, the people that we're leaving out going forward, folks have to pay an expensive and prohibitive cost share. I want to break it down on how much that is. It's 18% of the family income, but it actually means a lot more if you look at the numbers. If we're talking about a family of 4 in Catoosa County making $32,000 a year, their cost sharing is going to be up to $669 a month, which over a full year is $5,869.50. So, we're telling a family of 4 in Catoosa County, it's making $32,000 a year, and if they have a chronically ill member, that they have to pay $5,869 to get the care to keep their family member alive. That's groceries for the entire year. We are literally making people pick between groceries and medicine and access to health care. I also heard that this might degrade care for some people within 100 to 138% of the federal poverty level if we go to a Medicaid program. But right now, of those individuals, there are 200,000 that don't have health insurance that are already shut out of the marketplace. And many of those that are in the private plan don't get health care because they can't afford it. Earlier, the bill's House sponsor said, we don't just want to put an insurance card in people's pockets because then they can't pay for it and care is going to be reduced. But that's exactly what we're requiring of people between 100 and 138% of the federal poverty level. We're putting an insurance card, but then they can't afford to use it. If we fully expanded Medicaid and bridged the gap, these people would have free health insurance and free health care, and they would not have to pick the groceries. States that have expanded only to 100% of the federal poverty level have not fared well. My colleague mentioned Wisconsin earlier. Their neighboring states actually fully expanded Medicaid. Wisconsin now is about 4 to 8% higher in their uninsurance rate than they would be otherwise. Georgia has the 4th highest uninsured rate, but you know where it gets scary? It gets scary when you come to rural communities. We have the 2nd highest uninsured rate for rural Georgians, for rural Americans in the country. The only state that has a larger percentage of uninsured rural Americans is South Dakota. That's who we're competing with. We're talking about Colquitt County, 3,959 people without access to health care that would if we fully expanded. We're talking about Lowndes County, 6,792 individuals. We're talking about Thomas County, 2,527 people. Tift County, 2,592 people. 2,592 people in Tift County. People just like my colleague's sister who do not have health insurance that we could cover this year. Baldwin County, 2,545 people. And Whitfield County, next to my home of Catoosa County, 7,700 Georgians that don't have access to health care and that we are disregarding. Let me tell you, a typical community of 15,000 people, if we fully expanded, would see an extra 750 people get health care, and that community would see an extra $1.7 million in health care investment in their community for doctors, nurses, and in the people of our communities. And this bill is not going to have the impact on rural hospitals that we want. Rural hospitals would unquestionably fare better if we went to 138% of the federal poverty level. But my fundamental problem with this bill is we continue to punish poor people. We continue to hurt poor people in Georgia with things like work requirements for things that will save their lives. I would love to believe that we have unfettered opportunity in our state, but we do not. If someone is born in poverty in Georgia, they have an 8% chance of ever reaching the upper class in income, and they have a 41% chance of ever meeting the middle class. We are disregarding 50% of the people in our state under the guise of vast opportunity. But I'll tell you what, there's nothing wrong with those 50% of the kids in Georgia that would not be fixed by opportunity and support. And support includes access to health care for them and their families. Down here, I feel like my job is to speak for the least of these. And I think a lot of y'all are familiar with Matthew 25:31-46. Whatever you did for one of the least of these brothers and sisters, you did for me. And the disciples of Jesus asked him, what do you mean by the least of these? And Jesus responded, the needy, the hungry, and the sick. And aside from us continuing to punish people from being born poor and deprive opportunities to rise out of poverty through hard work, the most bizarre thing about what we're doing is we're leaving out hardworking Georgians making between $25,000 and $35,000 a year. We are intentionally and explicitly including any opportunity for expanded health care access with this bill to families making between $25,000 and $35,000 a year. And I know that Medicaid isn't perfect, but it works for people. I've got a good friend who's a Republican. He's got a kid with special needs. And he tells me the Medicaid program works for his and his families. We deserve better.
Gentleman's time has expired.
And the people of Georgia deserve better. Thank you, Mr. Speaker.
We will now recognize those who have signed up to speak in favor of the bill. Once again, a total of 30 minutes to be allotted amongst the speakers as they so desire. They will be called in the order in which they have signed up. The chair recognizes Representative Stover to speak to the bill.
Thank you, Mr. Speaker. I stand here today with my suit a little bit tighter than normal, and maybe I need to use the bariatric surgery. I'm not sure, but sorry, I try to put a little light on the situation here. Well, you know, we stand here and we argue that we need to expand Medicaid to 138%. We hear that argument. Then we hear the argument that we need to do the waivers. I personally stand before you today, shockingly enough for most of you, supporting this bill. I believe that an 1115 waiver coupled with a 1336 or 1332 is absolutely the right way to go. I find it interesting that as Representative Lott was presenting SB 106, and a fellow representative in the chamber here was asking her and talking about a study by the Georgia Chamber, Chris Clark was on Twitter thanking Jody Lott for carrying the bill, Governor Kemp for bringing it forward, and the Georgia Chamber was asking for bipartisan support. This waiver is not about expanding Medicaid. That is true. It does allow for a comprehensive remodeling of the program, and that is what Georgia needs. We need innovation. We need better quality and better access to health care. This bill does that, and a waiver can do that. It allows telemedicine, it allows community health centers, it allows systems to be put in place where cost sharing is put in across the board. We hear about the full expansion of Medicaid. Full expansion has cost $26 billion more than projected on the original expansion numbers. Medicaid expansion will only make this problem worse. Use of emergency care departments are already increasing because of Medicaid, especially in the states where Medicaid expansion has occurred. States that fully participate in Medicaid expansion saw emergency department visits per capita increase by 9%. 9%. So where does that money come from? Well, here in Georgia, it comes from the disproportionate share hospital payments under the upper payment limit. Payments combined in FY 2015 total $677 million. Everyone else pays for those who use the emergency room.
1115 waivers subject to a 180-day review period, including 60 days. The waiver must be submitted in June. We have a very limited window here, folks. Give the governor this ability to apply for this waiver. Trust our governor. Trust that he is going to reform the system. This may be our one last shot at changing the way Medicaid works in this country. And Georgia can be ground zero for that. The waiver may include, and this is just some of the things it may include, private-public partnerships for primary care, telemedicine expansion, work, educational, and community engagement eligibility requirement for childless adults, expanded and targeted access to primary care. We hear about Medicare for all. I know that Medicare costs my parents $800 a month. If you want to talk about Medicare for all, do we really want to tell Georgians they have to pay $800 a month to have access to Medicare? Medicare doesn't pay for everything. You have to have a supplemental insurance to pay for that gap. There's a gap on Medicare. Rather than argue that this bill doesn't go far enough, accept the fact that the 1115 waiver coupled with the 1332 waiver can and will improve access to health care in the state of Georgia. I urge each and every one of you to vote in favor of SB 106. Trust our governor. Trust the state of Georgia. Thank you, Mr. Speaker. I yield the well.
Chair recognizes Chairman Hawkins to speak to the bill.
Thank you, Mr. Speaker. I rise in support of the bill because I treat the patients that I see coming into my office, either in the office or in other clinics. And I will tell you that health care is vitally important to all Georgians, whether it be Medicaid, whether it be insurance plans, whether it be indigent and without any money, without any plans. For when they go to the emergency room and do not have the ability to have a medical home and follow-up care, diseases like hypertension and diabetes results in heart attacks, strokes, renal failure, eyesight loss, loss of limbs. It's a great tragedy for our citizens of Georgia to endure this. Now, this bill is only a beginning. This bill is not addressing everything that we will be addressing in the future. This bill addresses 1115 waivers for accessibility to Medicaid and 1332 waivers that will increase the risk corridor for insurance policies and help reduce cost and the deductibles. You know, each morning we come to this house and we begin the day with a devotion. And we're all together. We are one house. I ask for you to think of this bill as a first step and be one house and vote for this bill who will give more Georgians access, because voting against this bill denies those people. And let's look to the future and work again and continue to work for the rest of Georgia. I yield the well.
Chair recognizes Chairman Reinders to speak to the bill.
Thank you, Mr. Speaker. I have no illusions that nothing I'm going to say is changing anybody's mind. Just like probably no one else has. You know, politics is a funny thing, isn't it? Sometimes we do things for pure political reasons. Then we dress it up, try to own it, try to make it sound like it's us, and that's the reason. The other day in committee, I asked as the Atlanta Journal-Constitution calls it, the nonpartisan left-leaning Georgia Budget Policy Institute, a simple question. Will this bill help more Georgians, or are we better off without it? And they refused to answer. I asked them again, and they still refused to answer. That's code for you're making a point, but that's not our agenda. And to my friends on the left, you're right to question our agenda and where we're at in our politics. You should do that. If it's a gun bill, look at them. And as conservatives, if it's something to the left, look at them. We got to take that position. But sometimes it's okay to throw all of that away and forget about politics, and y'all know I love it. But to turn around and say, let's just not help 200,000 because we can't help them all? Patty Bentley, I just violated room, Mr. Speaker. I apologize. I told her, I love you. I know how difficult things have been for you. I watched her testimony in subcommittee. Thank you, Chairman Smith, for the great work you've done. We don't want some crumbs. We want the whole loaf. That was the quote we were given. Y'all, I can't live in a world, and I refuse to live in a world. I will not live in a world that says, you know what, I'm not going to give to Toys for Tots anymore because I can't give to every child. That is illogical. I am not ever going to help the Humane Society because I cannot help every one of God's creatures. That is illogical, and you know it. I'm not going to help the Atlanta Community Food Bank because we still have people that are homeless and hungry. And if I can't help them all, then I'm not helping anybody. I've watched this body for a long time. I don't know if I've ever seen a vote that said, you know what, while we're preaching needs-based, and I get that, on the Hope Scholarship, we're not going to vote for the Hope Scholarship because it doesn't help everybody. I've never seen that vote cast by either side of the aisle. I hope that when this is done, we will still help the Atlanta mission, even though they don't provide for every homeless person. Politics is a funny thing. I get it. The last thing we want to do, given the politics of last November, is to look at Brian Kemp and say, thank you for the start. You know that this bill makes Georgia better at helping some people than if we did nothing. And for you to vote no is something that we as conservatives lacking compassion, if you listen to the media every day, we're supposed to wear that. You're supposed to be the party that cares about everybody. This is your opportunity to vote yes and to say, you know what, we're going to help as many Georgians as we possibly can. Mr. Speaker, I wish I could feed everybody. I wish I could clothe everybody. I wish I could help every animal. I wish I could. I do my share, and we should all do our share. And our share on this bill is a simple yes vote. Thank you, Mr. Speaker.
Chair recognizes Representative Petrie to speak to the bill.
Thank you, Mr. Speaker. Ladies and gentlemen, I rise today as someone who has served individuals on Medicaid and indeed on Medicaid waivers for over 27 years. And I thought I would try today to just approach this from a 30,000-foot view and tell you a little bit about where I stand as someone who has long been opposed to across-the-board Medicaid expansion. And the reason I've been opposed to Medicaid expansion for all those years, you will discover I put on your desk today a great article that speaks. There have been many, but this is a good article from the Wall Street Journal that points to there's a lot of reasons to oppose Medicaid expansion. The cost, access to care that is already very limited for people that are the most vulnerable and frail in our society. But the number one most important reason to me has always been the same, and that is because Medicaid across-the-board expansion threatens our ability to serve the people that Medicaid was created for in 1965. Medicaid was created for the sickest and the most frail and the most vulnerable in our society. The frail, the elderly, the developmentally disabled, the mentally ill, individuals with traumatic brain injuries, children, women with children. That is what Medicaid was created for. And when we do across-the-board Medicaid expansion, we divert our attention away from that population to able-bodied working people. And indeed, there's proof that that has happened in Medicaid expansion states. And for that reason, I have long opposed Medicaid expansion across the board. Meanwhile, guess what we've done in Georgia rather than expand Medicaid? We've doubled down on serving the disabled in this state. Folks, we have doubled down on serving the sickest of the sick, and I want to right now take the opportunity to thank the Speaker, to thank our Chairman England, Chairman Dempsey, Chairman Parrish, for all of the improvements that we have made with, in many cases, waivers to serve those disabled populations. And I want to tell you about those in a minute, but the first thing I want to tell you is this. I support this bill today, and I'm going to ask you to do the same. Because this is not Medicaid expansion across the board. This is a waiver. So what is a waiver? A waiver is waives the federal standard, the standard federal government way of serving people, and it allows a state to seek its own way of serving people, to serve its own people in its own way, in a targeted way, with its own goals and by its own designs. We do that in Georgia today. We have lots of waivers. How many of y'all have constituents that are on the Community Care Services Program? How about the SOURCE program, the Independent Care Waiver program, the Planning for Healthy Babies program? Folks, we've got all kinds of waivers. We've been serving waivers for decades in Georgia, and guess what they've helped us to do? They've helped us to target populations to serve people better than you can do it in the federal way. Because the federal way for serving seniors, does anybody know what the entitlement route for serving seniors is? There's only one way: skilled nursing facilities. Guess what the Medicaid waiver way is? Serving people in the community where they want to be served for less cost. That is the impact that a waiver, a federal waiver, can have on our population. My friends, that's what the governor's seeking to do here today. To have the opportunity to consider a way to, now that we have focused our attention in Georgia on the people that are the most needy among us and never wavered from that. Now we have an opportunity to say, let's focus on those individuals, the poorest of the poor who are working in this state. They have a right to health care. They do. They deserve health care. Let's find a way to help them in a targeted way that this legislature can budget for, and you don't have the woodwork effect with a waiver, my friends, because it's not an entitlement. This is the way for us to improve access for individuals in this state that don't have health care, and I hope that you will join me in voting for this bill. Thank you very much, Mr. Speaker, and I yield the well.
Chair recognizes Chairman Parrish to speak to the bill.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, had the opportunity this afternoon to listen to our colleagues talk about this bill, and they've made very passionate and eloquent pleas on both sides of the bill. And I've said for a long time I could pick an argument. I could make a good argument why we should expand. I could make a good argument why we shouldn't expand. But I want to talk to you just from a little different perspective here. You know, some of us in this room are old enough to remember when Medicaid started. And if you stop and think about a program that's over 50 years old, I think most of you would agree with me that we need to do a little tweaking to that program by now, after 50 years. And the waivers that are discussed in Senate Bill 106 really would just allow some innovation and some tweaks to take place in our Medicaid program that we have. And let me just be the first to tell you right now that any of these waivers is not going to be a silver bullet to solve all of our problems. Expanding Medicaid totally is not going to be a silver bullet that's going to solve all of our problems. But what I want to talk to you about is how we can increase access to health care in this state. And I think that's what's important. And you, as members of this House, can be very proud of what you have done over the years to improve access to health care in this state. You can be proud that you put money in the budget to help fight maternal mortality, which is a terrible thing in this state, and we're going to do better about it. You can be proud that you have put money in the budget to create residency slots all over this state to train our future doctors who are going to come back and be the providers of care all across this state for people who are on Medicaid and need to be taken care of. And while we're talking about that, let me mention this to you too. We as a legislature are going to have to look at these providers across this state. If we don't pay providers a fair price for the service they provide, we're not going to have those providers out there. And what good would it do if we covered everybody in the state, but we don't have any providers out there to take care of them? I'm going to support Senate Bill 106. I think it's a step in the right direction that will improve health care and access to health care in this state. I'm going to support it, and I hope you will join me in doing that. Thank you, Mr. Speaker. I yield the will.
Chair recognizes Speaker Pro Tem Jones to speak to the bill.
Thank you, Mr. Speaker. As we've been discussing today, Senate Bill 106 is a straightforward proposal to allow Georgia to apply for an 1115 waiver to make cost-efficient and effective reforms to Medicaid as we know it. It also would facilitate a 1332 waiver application to construct innovative solutions in the private insurance market to bring down premiums, but I want to restrict my comments solely to the 1115 waiver. The intent pertaining to the waiver, 1115 waiver, is to reform current Medicaid provisions and provide a targeted safety net for others. The goal is also to protect Georgia from the long-term and significant consequences on the budget and its citizens as contemplated in the original provisions of the ACA. Let me say, and you've heard me say this before, Georgia is a generous state to the vulnerable and the needy. Individuals, churches, businesses, nonprofits, and governments give relief to the less fortunate with their time, donations, and tax dollars. In addition to currently funding $3.4 billion annually in healthcare services through Medicaid and Peach Care to 1 in 5 Georgians, including paying for 60% of births, our state funds another $2 billion yearly for services to the aged, developmentally disabled, addictive diseases, behavioral and mental health, and public health. I acknowledge that we should always be open to making things better, including working to help address maternal mortality by extending the time period after birth beyond 2 months that women are eligible for Medicaid. Senate Bill 106 would allow for such a reform. I want to address 2 quick points. Number 1, why limit the income threshold to 100% instead of 138% of the federal poverty rate? There's nothing magic about 138%. It was simply the figure selected by the Obama administration. There is something magic about the 100% level, though. Currently, as you know, every Georgian between 100 and 138% of the federal poverty rate qualifies for significant federal subsidies. In that gap between 100 and 138% currently, a single person receives subsidized premiums and would pay from $0 to $28 a month. As was mentioned earlier, not $335 a month, that's $335 a year. The most they would pay in that between 100 and 138 would be $28 a month. But better than Medicaid, these Georgians qualify for subsidized private insurance that is accepted by most doctors. There's a huge number of doctors in Georgia that do not accept Medicaid because it only pays 72% of the cost of care. I've heard about this gap between 100 and 138%. With this bill, if this bill passes today, there won't be a gap, because those would continue to receive the high subsidies that they do currently, between that 100 and 138%. Again, you would have thought from some of the comments that we were talking about all Georgians wouldn't qualify for Medicaid. Well, all Georgians wouldn't qualify for Medicaid if we did full expansion. We're talking between 100 and 138%, 2% of Georgians, a $4,250 yearly income difference. Everyone else would have some sort of coverage, including by the 225 federally qualified health care clinics that we have currently funded throughout Georgia. So why would Georgia substitute a government program such as Medicaid with limited medical providers, one that pays 72% of the cost of service, for available private insurance with generous subsidies paid by federal taxpayers? I don't know. But having an insurance card with the name Medicaid emblazoned across the top is not the same as access. Number two, I just want to mention, why give the governor the authority to reform Medicaid? And I think a little history is in order. A number of you, many in this body, were here as I go through this time period. Prior to 2006, a Georgia governor could unilaterally apply for an 1115 Medicaid waiver for significant reforms such as implementing managed care or expanding eligibility by means testing. After Georgia implemented managed care for Georgians for certain populations of Medicaid recipients, such as children and pregnant women, this legislature, passed Senate Bill 572 in 2006, which implemented a legislative approval requirement, as we are doing today, prior to the application of an 1115 waiver for significant program reforms such as managed care. The bill passed 154-1. Every single Democrat and every Republican but one passed a bill such as we're about to do today. The main argument was that the state needed a check and balance between the executive branch and the legislative branch. In 2014, I introduced HB 990 to provide the same check and balance on Medicaid decisions of significance on the budget. The legislation required a vote of the legislature before Medicaid reform could be implemented, before you could apply for a waiver that establishes income requirements for a population of recipients. One argument against the legislation, which was almost identical to the legislation in '06, was that it took power away from the governor, as contrasted with allowing him or her to make the decision unilaterally. In that case, every single Republican in this chamber voted for it, and every single Democrat in the House and Senate voted against it. I can't understand the inconsistency between 2006 and 2014. So which is it? Unilateral authority or input and guardrails approved by the legislature? In this case, I support Senate Bill 106, which would allow reforms to make Medicaid more efficient, effective, and merciful to our vulnerable populations. Guardrails are in place assuring that any actions as a result of this vote today would take place by June 2020, so we would be assured that it would happen in a timely manner while we're here. Additionally, we know that those that already qualify for generous federal subsidies for private insurance would not be pushed onto a government program that has been for the last 50 years designed for the most vulnerable among us, those who literally cannot provide for themselves. For these reasons, I do ask for your favorable consideration of Senate Bill 106. Thank you.
Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. We have a minority report. Under the rules of the House, 20 minutes is allotted for the minority report, it can be allocated amongst the speakers. The chair recognizes for the minority report Representative Fry.
Thank you, Mr. Speaker. I would like to yield my time to the Minority Leader, Representative Bob Trammell.
Minority Leader is recognized.
Thank you, Mr. Speaker. You know, I'm going to start. There's been a call and an appeal for bipartisanship, and I want to start by saying what a great thing that we're here at day 36 and we're talking about closing the coverage gap. That's awesome. But the question for us is this bill the best way to close the coverage gap? And I think a reasonable series of questions for us to ask when we're comparing any policy, particularly in the healthcare, is a couple of fundamental questions. The first is, who does it cover? The second is, what does it cost? And the third is, when is it implemented? And I want to spend the majority of my time here just talking about the first question, who does it cover? Other colleagues have talked about and covered, and other colleague will talk about Medicaid expansion and going to 138. I just want to talk about what the language of the bill itself says, which is authorization for an 1115 waiver up to 100% of the federal poverty level. So let's set the conversation about Medicaid expansion and going to 138 on the side for a second. And let's just talk about up to 100% of the federal poverty level. Does anybody know what 100% of the federal poverty level is for a single person? $12,490. Let me repeat that. $12,490 for a single individual. So when we talk about the proposition of trying to provide health care coverage for people under 100% of the federal poverty level, for a single individual, we're talking about people who make basically about $1,000 a month or less. And the number of those individuals who do not have any type of coverage at the moment is about 250,000, 250,000. So the question that should be on the table is, are we willing to do a policy that would cover all those people? Again, set Medicaid expansion on the side. Let's just talk about, are we willing to cover everyone up to 100% of the federal poverty level? And you know, I'm a lawyer. And when people come to my office and they ask me questions about deals or agreements, the one thing I frequently ask them is, do you have it in writing? Because if you don't have it in writing, it doesn't really mean anything. And this bill doesn't have that in writing. It guarantees coverage to no single individual between 0% and 100% of the federal poverty level. But you know what's worse? We can't even get a verbal commitment that the intention of this bill is to cover everyone under 100% of the federal poverty level. And that is the fundamental problem with this legislation. We don't know what it'll do. You know, in my previous experience working at a big firm, I learned one thing about consultants. If you wanted to fire someone, the first thing you did was hire a consultant. The consultant would come in and say, well, we've done a look top to bottom, and this is what we think, and they recommend who gets fired. And then you take action and you get fired. So when I read this bill, and in the context of a budget where we're hiring someone to be the consultant to recommend the waiver, you know what I hear? People are going to get left out. And we didn't have anything to do with it. Not this General Assembly. That was the consultant. The consultant recommended the 1115 waiver, and we just followed what the consultant said. That's why you hire consultants, because it's a delegation of responsibility. But you know, when you delegate responsibility, there's another way of saying that. You abdicate responsibility. And that's what this bill is. It's an abdication of our legislative responsibility when it comes to talking about healthcare policy. And if you want to know where that is, that's lines 23 and line 24 and 25 of the bill. It says when you get this 1115 waiver through, they don't have to come back to the General Assembly for further action. They can just set sail on whatever course they want. So when we talk about who this covers, let's not pretend that this is a bill to cover everybody under 100% of the federal poverty level, because it's not in writing and they won't say it from the well. They won't even make the commitment from the well. I'm not talking about putting it in writing. We're going to pay a consultant to come back and say, well, you know what, it was just too difficult. And I want to make one other comment about the WHO and the 138. You know what's a magical number? Why 138 is a magical number? Because the Affordable Care Act guarantees 90 cents from the federal government to pay for the coverage. So what we're talking about is more expensive. When you get to that, how much does it cost? So it covers fewer people, it costs more, and it starts later than Medicaid expansion. And I've talked more than I intended to, but I want to tell you this. I have health insurance. When I go to the doctor, you know what the first question they ask me in the reception room is? They ask for my insurance card. For these 250,000 Georgians below 100% of the federal poverty level, they don't have that option. So we can talk about this as a health care access bill all we want. But the fundamental thing is that we are making a policy choice that does not provide coverage for individuals. They will not have that card in their pocket. They cannot make the same type of choices that we all have the ability to make, because every member in this General Assembly has the ability for a state-paid health insurance plan. But under 100% of the federal poverty level, well, we're making a choice and we're saying, too bad. We're keeping people from being able to go to the doctor. That's what we're doing. So, Mr. Speaker, I'm going to yield the balance of my time to Representative Buckner for the minority report. But I want to tell you, while I'm excited we're having this conversation about closing the coverage gap, I lay down this challenge. Tell us who we're going to cover under 100% of the federal poverty level. Who's it going to be? If I'm wrong about that, I'll be happy to stand corrected. But if the answer is that we're waiting until the consultant comes back, I've seen that movie before, and I know how that movie ends. And it ends without Georgians who we could cover as a legislative body today not getting health care coverage. Mr. Speaker, I would yield the balance of the time to the minority report to Representative Buckner.
Representative Buckner is recognized for the balance of the minority report.
Thank you, Mr. Speaker. Ladies and gentlemen, regardless of the location, the demographics, or the economic status of our districts, we all have constituents in the health care coverage gap that live within our areas. This bill is about waivers, and by definition, a waiver is an intentional act to abandon a known right or privilege. What are we waiving, and what are we hoping to receive? I really can't tell from this bill, and that's why I stand before you presenting this minority report. I am opposed to Senate Bill 106, the bill, for 3 reasons. It lacks structure. It sets the maximum federal poverty level too low without a promise of covering that entire group, and it relinquishes our legislative authority for a matter that is far too important, the health of our constituents. As a member of a group of 5 legislators and 1 lobbyist with over 150 years of healthcare experience, we gathered to discuss Georgia's healthcare delivery system, how to address the healthcare coverage gap, rural hospital closures, and this bill. We discussed whether this bill provided guidance, or some people have called it guardrails, to provide much needed coverage for our fellow Georgians. We determined that there was an absence in this bill of specific components to address the unique health care needs of our fellow Georgians, and that was unacceptable. We dreamed of a possibility of a real conversation of creative, innovative ideas to cover the gap of uninsured Georgians. And we talked about an existing program that has been quite successful at providing health care coverage to Georgia's children, Peach Care for Kids, and its applicability to adult health care needs. We wondered if we established a program for residents between 19 and 64 that had an income-based sliding scale where there was no premium for those 100% of federal poverty below, and for the people 101% to 138%, there would be a premium based on their income. Could we receive the 90-10 federal match? Because that sliding scale would be cheaper than Medicaid expansion, but yet would cover as many lives. In other words, we would cover all the gaps. On line 22 of the bill, setting the income threshold at a maximum of 100% is too low. Plus, based on testimony, it's unclear if even all of that will be covered. Let me bring it home for you. I want you to imagine that your only income is your legislative paycheck and that you do not have access to the state health benefit plan. That's all the money you have, and you have no other insurance. In many cases, you would find yourself in the gap. Now, I've heard some people say, and we need to think about this, we are all able-bodied adults. So as able-bodied adults, we should somehow be able to get coverage, even though we are limited to that legislative income. Able-bodied adults argument imposed by some seems to imply that Georgia citizens who do not make enough money are not entitled to health care in Georgia. And that is both offensive and it is extremely short-sighted. I've seen people who work very hard for companies that provide expensive yet practically worthless health care coverage. And that means that many able-bodied adults work very hard, save for the day that they may need to pay for their health care out of pocket, living in fear that they will have an accident or that they will become ill. And they should be afraid, because once again in 2018, the #1 cause of bankruptcies in Georgia and in the United States was directly related to unpaid medical bills. It affects millions of citizens every year. I know this and past majority leadership has maintained opposition to Medicaid expansion. However, if waivers are going to be considered, they are generally being offered at a 65 to 35% match instead of the expansion match of 90-10, therefore costing the state more. I think it's the responsibility of this General Assembly to establish some guidelines for those waivers. As an example, one of the things we talked about was the Peach Care for Adults with affordable premiums for working families, more affordable than the exchange. Plus, many of the exchange choices are not even known to Georgia providers, but Medicaid is. The sliding scale would provide for the skin in the game that so many of us need and want, but it would also drive down the cost. Special features could be incorporated. We have a terrible adult immunization record, so we could improve our immunization rates and have all adult immunizations covered. We are 49th in the country of mamas dying after giving birth. It usually happens in months 6 to 8. We could expand the coverage from 6 weeks postpartum to a year to try to help prevent those deaths and improve our ranking. A Peach Care for Adults type program would infuse the payment system to rural hospitals and to medical doctors and other providers. While some changes in the certificate of need might be needed, the real need for all of our hospitals, and especially rural hospitals, is a reliable payment system for the services rendered. Lines 23 and 25 trouble me greatly. To say that there will be terms and conditions of waivers determined without any further legislative action. Who will speak for our constituents? Why would we give away our authority for something so important as life-saving medical services? And why would we give away our authority to assist providers who are holding on by a thread? I think about things we take up in the Ways and Means Committee and how much we do to help other businesses. And we're going to relinquish this authority for this business? I'm a health educator and I work for the Department of Public Health. I've worked for a for-profit hospital and a not-for-profit hospital. And I have long been a proponent of the expansion of the Medicaid program. I have been involved with and been a keen supporter of the Peach Care for Kids program. And I have been an advocate for quality and cost-effective health care for all for years. And in the past, Georgia has been a leader in health care with innovative programs and rankings much better than 49th out of 50, like our current maternal death rate. I cannot help but wonder, how long can Georgia remain the #1 place to do business in our citizens are not healthy? We give a great deal of assistance to other businesses, but what are we really doing for health care instead of doing to health care? Senate Bill 106 lacks structure. It sets the maximum federal poverty level too low, and it relinquishes our legislative authority for a matter far too important, the health of our constituents. This is not a generous plan. It is more expensive, and it ensures fewer Georgians. And for these reasons, I sincerely urge you to vote no on Senate Bill 106. Many of you have said, well, if we don't do 106, it's just we're not going to have any coverage for our folks. What are we going to do? I can assure you, if we send the message today that we are still the House of Representatives in Georgia and we want to have authority in taking care of the citizens of Georgia, they will come back with an alternative plan. And that's what we need to be talking about, improving this bill. And with that, I yield the well and urge you to vote no on Senate Bill 106.
We're now going on to the chairman's time, and by rule it is also 20 minutes, and the chairman can allocate that time and yield his time. Chair recognizes Chairman Richard Smith.
Thank you, Mr. Speaker. You know, when this special committee on access to quality health care first got started and we were looking at Chairman Hatchett's CON, I made the comment at that committee that, you know, y'all be getting calls over the weekend that the sky is falling because Chicken Little has arrived. Well, I think you need to take a look at Senate Bill 106. It does three basic things. It increases accessibility to health care, ensures greater affordability not only for Medicaid but for those who have individual policies or small group plans. It also improves quality, and I think you need to understand and listen to that again. Increases accessibility, affordability, and quality. I hope you listened to what Representative Petrie said, because he was right on target with his comments. Now, there's been a lot of talk about 1115 waiver. There hadn't been a whole lot of talk about 1332, but I'm going to tell you a little bit about 1332. There are people out there right now who are paying $2,400 a month premiums. There are people out there now who have premiums higher than their mortgage. What are you going to do about these folks? You know, I'm not going to spend a lot of time. I think it's important that the floor leader gets a chance to finish this up. But, you know, 1332 is a waiver to look at innovative ways, as is 1115. And that's what we've got to look at, because your Medicaid system has not been successful. I want to give you a little figure here. For those of you who like money, the total percent change in state funds appropriations, now these are state funds appropriations from 2008 to 2019, is a 53% increase for Medicaid. 53%. That's just normal growth. So let's do something for the state of Georgia. Let's do something for the citizens of Georgia. Let's pass Senate Bill 106. I'm going to relinquish the remainder of my time to Whip Kelly, and then also the remainder after that to Floor Leader Lott. Thank you, sir.
Chair recognizes the Majority Caucus Whip, Representative Kelly.
Thank you, Mr. Speaker. And we heard just a few moments ago the minority party talking about promises and commitments. So let me remind this body about the greatest failed promise of a commitment that the minority party has made about health care. And that was, if you like your doctor and you like your health care plan, that you can keep your doctor and you can keep your health care plan. Now we know that that failed promise was made by then President Barack Obama as he sold the American public a gallon of snake oil. Now what we have today in SB 106, the Patients First Act, is a measure that will truly put the health care of Georgians in a better position. We've heard the minority party talk about 500,000 Georgians that could be covered under their plan. But what they don't tell you is that 250,000 of those people are already covered under private plans, and that the other 250,000 will be covered under Senate Bill 106. But that's not a shock. We've seen the minority party turn time and time again to more government to solve our problems. In fact, they've rejected the failure that is known as Obamacare. We've heard even their party now talk about moving past it to what is truly government-run health care and Medicare for all. But let's talk about what Senate Bill 106 will do. Senate Bill 106 will provide health care, access, and coverage to 250,000 Georgians. Those individuals making that $12,490. A vote for Senate Bill 106 will cover that. A vote no will turn your back on those people. But Senate Bill 106 will also give us the opportunity to do other things. Senate Bill 106 will lead to opportunities for us to create a reinsurance plan for our state that will drive down insurance premium costs, something that the Not Affordable Care Act did the opposite of. How many of you in your districts have had hardworking contractors, small business owners, people who are trying to just make an honest living come to you and talk about how much their insurance premiums have gone up since the last time we listened to the minority party on health care? Today we have an opportunity to help those 250,000 Georgians who don't already receive coverage in our state. One of my friends who spoke here in the well earlier quoted a Bible verse, and I want to share one of my favorites with you. The 18th verse of the first chapter of Isaiah says, "Come now and let us reason together." Because a reasonable vote today is to give coverage to the 250,000 Georgians who don't already have access to health insurance in our state. That's the reasonable approach. But in a moment, after the floor leader finishes up, we'll have the opportunity to cast our votes. And I hope that those in this chamber will not abdicate their responsibility for taking care of those 250,000 Georgians by voting against this measure. The correct measure for those 250,000 Georgians is to vote green. And Mr. Speaker, I'll yield the well.
Chair recognizes the governor's floor leader, Representative Lott, to conclude the chairman's time.
I thank you all today for bearing with this spirited debate. And things have been said that were some true, some untrue, not intentional, I'm sure, but healthcare is complex. It is, in my opinion, one of the most complex industries that there is. I am here to say that it was this book, Subtitle E, Affordable Coverage Choices for All Americans, Part 1, Premium Tax Credits and Cost Sharing Reductions. In this section of the Affordable Care Act, passed in 2010 by the federal government, it clearly states that if you are at 100% of the federal poverty line, that you have an opportunity for the federal exchange plans with subsidies. I know that was said earlier, and yet 3 people followed behind to say again and again that there's a gap to 138. This is the book, and you're welcome to read it. It's a great read. But I will say this, let's get our facts straight. Let's make sure if we are going to vote no on this legislation that we understand what we're voting for. Someone else came up and said, who does it cover? This bill is not about just the 240,000 estimated folks below 100% of the federal poverty line that are officially in the actual coverage gap. Those people below 100% of the federal poverty line actually are the one body of people in the coverage gap, and they do not have access to the federal exchange subsidy plans, and they do not have access to Medicaid. This bill does count them, but we cannot forget that there are 1.3 million people in Georgia that are uninsured, and they are uninsured because it is unaffordable. The 1332 section of this bill is critical to the people in Georgia. This is the part of the bill that has been proven in other states to lower the insurance premiums for those in the individual marketplaces, those that are currently in the individual marketplaces and small business exchange plans. But with the additional 1 million people uninsured, the hope is that we can lower those premiums to make it affordable for those people to jump in, to also have coverage. So to be small thinkers and think this is a no vote because there's 240,000 people that you may or may not cover, you may or may not get your providers in line, and maybe our coverage gap is a little broad. Our intention is to give affordable healthcare opportunities to every Georgian. That is what we're here for today. That is what this is about. But let's remember, this is a big picture debate. Healthcare is complicated. It is complex. This is the first part. This is one piece of the pie. And as I said when I spoke earlier, if this bill does not pass because we are convinced that we could do something different, it will not change the fact that Governor Kemp has made health care a priority in Georgia, and that we will work to reevaluate our Medicaid system. Another falsehood is that what we will do is we will continue to look for waivers, and we will actually submit waivers because not all waivers require us to come to the General Assembly. And as stated before, people want us to have the ability to regulate the waivers. Well, we don't now. Only 2 waivers require us to come to the General Assembly, the one that expands the eligibility and the one that is the 1332 waiver. So I understand everyone will have an opportunity to vote. I certainly ask for your yes vote on this because this is the start to moving the ball forward on health care in Georgia. And I ask for your favorable consideration of this vote. Thank you, Mr. Speaker. I yield the well.
Lady has yielded the well. The previous question has been ordered. Mr. Clerk, you want to ring the bell? Is there any objection to agreeing to the report of the committee which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill, Senate Bill 106, now pass? All those in favor of the passage of the bill will vote aye. Those opposed will vote no, and the clerk will unlock the machines. Have all members voted? Have all members voted? If so, the clerk will lock the machines on the passage of Senate Bill 106. The ayes are 104, the nays are 67. This bill, having received the requisite constitutional majority, is therefore passed. Chair recognizes Chairman England for a motion.
Mr. Speaker, I move that the House insist on its position on House Bill 31, the FY20 budget, and appoint a committee of conference.
Chairman England has moved that this House insist on its position in disagreeing to the Senate substitute to House Bill 31 and that a committee of conference be appointed. The clerk will read the caption.
To be entitled an act to make and provide appropriations state fiscal year beginning July 1st, 2019 and ending June 30th, 2020.
Is there any objection to the gentleman's motion? Is there any objection to the motion from Chairman England? Chair hears none, and this House has insisted. The chair appoints Representative England from the 116th, Representative Burns from the 159th, and Representative Jones from the 47th as a committee of conference on House Bill 31. We have a supplemental local calendar that has been on your desk. What purpose does Chairman England rise?
To make a motion, Mr.
State
Speaker.
your motion.
I move that we immediately transmit our actions on House Bill 31 to the Senate.
Chairman England has moved that House Bill 31 and the action of this House be immediately transmitted to the other chamber. Is there objection? Is there objection? The chair hears none, and it is immediately transmitted. You have had on your desk this afternoon a supplemental local calendar. We're going to take that up now. Third reading and passage of an uncontested local bill. If there is no objection, we will vote on the local calendar as a whole with a recorded vote. Hearing none, it is so ordered. The clerk will read the local calendar.
House Bill 599 by Representative Alexander, the 66th. House Bill 599 states that a member of the Douglas County Board of Commissioners shall be paid up to $6,000 a year for expenses incurred on official business.
Is there any objection to the previous question being ordered on the local calendar? The chair hears none. The previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall this bill now pass? All those in